Hi,
Hi.
my name is Andrea and I'm a student nurse.
Hello, I'm Christa.
Do you
I'm a
mind if
nurse here at the hospital.
Do you mind if I shadow you today?
No, that's great.
Can I ask for an SBAR on the patient that you're taking care of?
Of course. Okay. So, the patient that I have is Glenn Light. He's in room 619. He is 67 years old, a male, no known allergies. He's a full code. His admission doctor was K. Phillips. He's 171 pounds, 5'11". His BMI is 23.9, and his current diet is an 1,800 calorie diabetic diet, and he has a 2-gram sodium restriction. His primary diagnosis that he was brought in for was a stage 2 diabetic ulcer on his right heel, and that is secondary to diabetes mellitus type 1. He has a history of increased blood glucose readings for the past 5 days with results consistently in the 300s. And he also has a non-healing wound on his right heel. And he noticed this about 3 weeks ago. He was diagnosed with diabetes 20 years ago, and his last hemoglobin A1C was 5.2%, and that was taken 3 months ago. Some history that he has, his father died of an MI at 53, and the mother died of lung cancer at 78. But he denies any previous significant illnesses. Some surgical history, he had a transurethral prostate resection 5 years ago, and he denies tobacco use, but he does admit to drinking one 16-ounce can of draft beer each Friday evening while bowling. So we'll do some teaching about that and how it can actually drop your glucose levels. So talk to him about that, and he admits to no formal exercise plan, but he walks when he can. So we'll monitor him for glucose control, we'll give him some diabetic teaching, and some pain management and wound evaluation and care. So he is a medium fall risk, and he's at risk for pressure sore. His pain was 1 on a scale of 1 to 10 at 1645. His output is 320 milliliters. He denies any change in thought, speech, or memory, but he does admit to tingling in his bilateral lower extremities, and that's worsened over the past 3 months. He does wear glasses for vision, and he's alert and oriented ×4. But he does have a deficit in sensation to a pinprick in his bilateral lower extremity. He denies cough, dyspnea, wheeze, or chest tightness, but his lungs are clear to auscultation in all lobes. His breathing is unlabored without accessory muscle use, and his S1 and S2 heart sounds are auscultated without a murmur, rub, or gallop. He has a regular rate and rhythm with no carotid bruit. He denies chest pain, palpitations, or edema. So like I said earlier, he's on the 1800 American diabetic diet, but he's had decreased adherence over the past 9 months and wants a diabetic diet teaching. He denies any change in bowel habits. His abdomen is flat, symmetrical, soft. There's no tenderness. His bowel sounds are present in all 4 quadrants, and there's no ascites or bruits present. He denies any flank pain, dysuria, or problems with urination. So more about the ulcer. It was found about 3 weeks ago. It's 5.5 centimeters by 2.5 centimeters. It's a partial thickness loss. He did try soaking it in salt water, but it gave him no relief. He has a 3 centimeter deep extending, it's 3 centimeters deep extending into the dermis. The wound base is pink. There's no tunneling or undermining noted. There's moderate serosanguinous exudate. And the doctor ordered us to dress it with a dry, sterile dressing. His vitals at 1645 were a respiration of 18, heart rate of 76, O2 saturation of 96, and a blood pressure of 128/70. And his medications that he's getting is simvastatin, gabapentin, NPH and regular insulin, Lispro, which is what we'll actually be administering to him, and PRN morphine. And at 16:45, his AccuCheck was 290. And according to the doctor's orders, if it's 290, we'll be giving him 6 units of the Lispro. And he has an IV site on the right median vein, forearm, peripheral, and as I said, he actually had a new hemoglobin A1C done, and it is 6.5%. And his fasting blood sugar was 310, and his albumin is 4.2. So yeah, we're gonna be giving him his insulin medication today.
Why specifically is this client receiving this medication?
Well, this client has diabetes mellitus type 1, so the beta cells inside of his pancreas actually don't make insulin anymore, so he has to get it from an external source.
What action does this medication have on the body?
It helps facilitate the movement of glucose into the cell, and it'll actually help bring in potassium as well.
When should you question administering this medication?
You'll always question it if the blood glucose is low, so you'll always want to check, have a finger stick glucose before you administer it, so you do not send him into hypoglycemia.
Does this medication have a therapeutic serum level?
Yes, it's 70 to 120.
Which vital signs do you need to monitor?
You'll want to monitor all vital signs, but specifically the blood glucose, because of, again, hypoglycemia.
Which physiological parameters should be monitored when this medication is being given?
The blood glucose, of course, and you'll want to check to see if he's having any adverse reactions to show that he's having hypoglycemia. Like he could be sweating, he could feel fatigued, or he could actually have tingling on his lips. So you'll want to make sure that he knows of all those signs in case he is getting hypoglycemic.
What interventions must be taught to his patient in order to ensure that the medication is administered safely at the hospital?
Well, you will want to teach him to always wash his hands before, always use clean needles, never share the needles with anybody, and make sure to rotate sites, but it's best to rotate in the same region, so have him do the different quadrants of the stomach when he's giving his insulin. Always dispose of the needles correctly in the sharps container, and watch for signs of irritation or hypoglycemia, and just make sure you're always checking your blood glucose.
What interventions must be taught for taking the medication safely at home?
At home, you'll want to do the same thing. Make sure you're clean, always washing your hands, and just assess the site to see if there's any irritation to where you shouldn't be using that site again, and just checking for signs of hypoglycemia, and never sharing needles, always checking the expiration date, and just making sure that it is the right medication and that you are not too low in blood glucose.
What are the side effects and potential adverse reactions?
Well, the most severe one, which is not common, would be anaphylaxis. So that's a big one, but most people don't usually have that. But a common one would be hypoglycemia. So an easy way to prevent that is to just always check the blood glucose before administering the insulin.
How will you know if the medication is effective?
If it is within the therapeutic serum level, which would be 70 to 120.
Thanks.
Okay, great. So now we're going to administer Glenn Light, his medication. So we're going to check in the chart, and we're going to make sure, we're going to see if he has any allergies. So he does not have any allergies, so we are going to be able to give him the medication, but we'll still ask him when we get in the room, okay? So let's go over. Hello, I'm Christa.
Hello.
I'm going to be your nurse today. Do you mind if a student nurse watches me give you your insulin?
No, that's okay.
Okay. How are you doing today?
Doing good.
Okay, good. And how was dinner?
It was very yummy.
Okay, good.
Thanks for asking.
Could you tell me your name and age, please?
Sure, it's Glenn Light, and I'm 67 years old.
Okay, great. Thank you. I'm going to check in the chart for for the name and the age, Glenn Light, 67. And do you have any allergies?
No, I don't have any allergies.
Okay. And I'm going to check in the chart, and it says no allergies as well. Okay. So now we're going to check the order against the MAR. Okay. So right now the drug due is, medication due is insulin Lispro, Humalog, and it is 1711, and it is due at 1700, so within time. Okay. So now I'm just going to do the 5 rates. You always want to check that it's the right person, the right medication. So could you tell me your name again?
It's Glenn Light.
Glenn Light, okay. Right medication, which I will be getting. Insulin Lispro, okay, and the dose, let's see. So the doctor said for blood glucose readings of 251 to 300, we will give him 6 units, and his AccuCheck was 290. So we'll be giving him 6 units. And the route for insulin is subcutaneous, but we'll always just want to check another source to make sure, just to be safe. Okay, so if you can see there, it says subcutaneous. Okay. Okay, so now I'm going to just compare it again, just to be safe. Okay, so it's the right person, there's the right medication, insulin Lispro, the dose is 6 units that I will be drawing up, the right route, subcutaneous, which I just checked, and the time is 1713 now, and it is due at 1700. Okay, so I'm going to go and scan the patient. Beep. Okay. And could you tell me your name and age again?
It's Glenn Light, and I'm 67 years old.
Okay, thank you. Okay, so now we're just going to enter this. And could you read me the numbers on your wristband?
Yeah, sure. It's 7718154.
Okay. The medication barcode is D9BC. Would you mind reading me your patient ID? There's 2 numbers on there.
Oh, sorry.
Maybe it's the other one.
It's 650 255 5339.
Okay, thank you.
Yeah,
So now you can see that it's a green light, so it is okay to give him this medication. Okay. So, we already checked the drug guide to make sure that it is okay to give him this through the route. And have you had insulin before? It says for 20 years you've been a diabetic.
Yeah.
So you're aware and you're not allergic to it?
No.
Okay. Okay. So now we're going to compare the med label to the MAR after I draw it. So we'll wash our hands again. And I'll check and make sure that it is non-expired. If it's not, just roll it. Put this in the trash can because I don't have them in the room. Okay. So the order is for 6 units. So I'm going to drop 6 units of air. Oh, would you check this and make sure? Do you believe that is 6 units?
That's 6.
Okay, great. And I'm going to do the scoop method. Okay. So now we're going to do one last check before we give the medication. Okay. So right person, we know that here because it's green light. The right medication, which is insulin Lispro. Right dose, which is 6 units because blood glucose is at 290. Okay, the right route, we're going to be doing subcutaneous, and the right time, do it 1700 and it's 1719. So we're good on that. Okay. Now, so where would you like your injection?
Like in my abdomen, like
Okay.
my upper right abdomen.
Okay. And where do you usually administer your insulin?
I usually do it in my abdomen.
Okay. And are you aware of switching sites?
Yeah, I rotate my sites.
Okay, so where are the spots that you usually rotate it?
I usually rotate my abdomen, but sometimes I'll switch and I'll do left and right back of my arms.
Okay. And do you know what that's helpful for?
Just so I won't have irritation.
Right.
Mhm.
Okay, good. Are you having any pain?
No, I feel fine. Thank
Okay, good. I'll wash my hands. Now we're going to document where we gave it. Okay, so let's see. Okay, so the administration time was 17:19. So it was the right upper quadrant of the abdomen. you gave 6 units due to the blood glucose being at 290. Patient tolerated well, no pain. Okay, then you're going to initial it and click save on that. Okay. So, I heard that you wanted some diabetic diet teaching.
Yes, please.
Okay, so since you're on the 1800 calorie restricted diet, you're going to want to watch your calories. And so I saw that you go out on Fridays bowling and you have alcohol.
I'm a great bowler.
You're a great bowler. So I saw that you have some alcohol once a week. So just so you know, alcohol can actually drop your blood glucose levels. So you want to keep that in mind and make sure that you're including the calories from the alcohol, because sometimes people don't include the things that they drink when they're calorie counting. So do that, and you're on a 2-gram sodium restriction. So some things that have a lot of sodium, one thing you wouldn't expect is celery. And you'll want to always check the food labels, and you're going to want to watch out for canned foods because that can have a lot of sodium.
Okay.
So what's one thing that you wouldn't expect to have sodium, but it has a lot of it?
Celery.
Yeah.
Yeah.
And what we always want to read before eating something?
All your food labels, so I can count my calories.
Okay, good. And so for your insulin administration, do you have any questions?
Let's see. Oh, I had some question. Is there any place I can go to get information if I remember my question?
Yeah, you will always want to come to the hospital because that's the best source, and just ask one of the healthcare personnel for anything. Okay, is that all I can help you with today?
Yeah, you've been very helpful.
Okay, great. So I'll lower your bed to the lowest position. Bed rails give you a call light. Is everything within reach?
Yeah.
Okay, need any water or anything?
No, I'm fine.
Okay, great. Well, I'll be back in about 30 minutes to check on you and see how you're doing.
Okay, cool.
So did you have any questions?
Yes. Were there any pertinent pieces of information you reviewed before you gave the client his medication?
Yes. Well, I reviewed the doctor's orders because his glucose was at 290, and it says here that when his blood glucose is 251 to 300, you give him 6 units. So that's why I administered him the 6 units.
Did this information affect your decision to administer the medication?
Yes, because it told me how many units I'm going to need to give him.
Did this information affect how you gave the medication?
Yes, because if it was too low, I wouldn't give it because that would send him into hypoglycemia.
Thank you.
You're welcome.